Hello, everyone, and happy Thursday Night Live. If you are watching this live, you are an Area Circle member. You get early access to these. If you're watching this on a Thursday, please join us. You can get not only early access, but you can get access to all of the other 200 or so lectures that we have in our incredible vault. I have a very special guest with us today. She's become a friend of mine. Toni-Ann Antoniato, thank you so much for being here. Janine was supposed to be here, but she's not feeling well.
Yes, she's not feeling well, but I will speak for both of us, and we are so excited to be here.
Perfect. I'm going to go ahead and introduce you to everyone and introduce the topic, and then you can share your screen after that. Toni-Ann Antoniato is a speech-language pathologist and certified lactation counselor specializing in myofunctional and orofacial disorders. She is the SLP Director and business partner at the Long Island Center for Speech and Myofunctional Therapy, where she leads evaluations and supervises clinician training through their S.P.O.T program. Toni-Ann also has experience teaching in the Speech-Language Pathology Master's Program at Stony Brook University. The topic today is S.P.O.T for patients with OMDs and how it complements myofunctional therapy. I cannot wait for you to share with everybody S.P.O.T. But before we even start sharing the screen, and you might share this in your presentation, how did you even think about it? How did you first come up with it? How long have you been thinking about this before it was in your hands?
Right. Yes. So a little background on the product. In 2020, obviously, all our worlds kind of changed at that point, right? COVID. And Janine had this idea of this tool and appliance to help complement myofunctional and speech therapy. And because things kind of changed and we were more virtual for the first time in 2020, we felt like this was the perfect time to really start turning this idea into a prototype. So her and I worked together to do that. And we started using the S.P.O.T appliance in-house only. So we have 9 offices across Long Island, New York, and we just used it within our own practice for 2 years, just over 2 years. So we wanted to really make sure that we were seeing exactly how we wanted to use this appliance. So much of the variations that we'll talk about came about in that time because we were like, well, you know, they're in mixed dentition and we still want them to be able to use this, or they're missing their 2 front teeth and we still want them to use this. So lots of variations came about in those 2 years. And then in 2023 was when we went live to the market. So it's been a ride. It's been fun, and I'm really excited to share about the product today.
All right, perfect. Let's share your screen. And I am drinking my South Brazilian mate. We call it chimarrão. It's just hot water. It's delicious.
Very nice. Okay, let me get this out of my
screen. That's it.
All right. You see that okay?
That is perfect. Go ahead.
Perfect. All right. So I will go into this presentation about how we utilize S.P.O.T as a myofunctional therapy tool for patients with orofacial myofunctional disorders, and how, most importantly, it complements myofunctional therapy. Again, you heard a little bit about me, Janine Stiene, who is sad to not be able to join today because she's not feeling well, but she is my mentor. I worked under her and alongside her for almost 10 years before I became her business partner and took over her responsibilities with our myofunctional evaluations. And with her training, I now do over 400 myofunctional evaluations a year. And I also monitor all of our myofunctional patients among all 9 offices, where I see them for follow-up check-in appointments as they're progressing through our program. So I do their initial evaluation, I set up their treatment plans, they see our trained therapists for their therapy sessions, and then they see me as they progress through our program to make sure everything is going exactly how we want it to. So as myofunctional therapists, we know that improper tongue resting posture, mouth breathing, a tongue thrust swallow, those are problems that we see on a regular daily basis in our patients. And we know that an improper low or forward tongue resting posture and mouth breathing is going to result in poor growth of the lower jaw, upper jaw, the midface, the palate, because our tongue is our palate's natural expander. When that tongue's not resting correctly and we're mouth breathing and not swallowing correctly, it's going to narrow the palate and oftentimes can result in difficulties with sleep and sleep disordered breathing. A tongue thrust is that abnormal anterior motion of the tongue during swallowing. So when we swallow, our tongue should suction to the roof of our mouth. And for patients with OMDs, a lot of the times instead, the tongue is thrusting forward against or between the teeth. And according to ASHA, a tongue thrust swallow is estimated to exist between 33 to 50% of our general population of school-aged children. And when we have a tongue thrust swallow, a lot of the times it does impact articulation. This is going to be those children or adults who have a lisp or have difficulties with their R sound. So a great population of our tongue thrust patients also have articulation errors. So with S.P.O.T, we are working to resolve and help support the resolution of those problems. We know as myofunctional therapists and professionals that nasal breathing is essential, that proper oral posture is fundamental, adequate strength of the orofacial musculature is imperative, and practice and repetition is pivotal in neuromuscular re-education. So with knowing that, we have created S.P.O.T as a myofunctional therapy tool. At S.P.O.T, we say don't skip tongue day because we know that the tongue is such an important muscle that can have such a positive impact on so much for us. S.P.O.T is a custom fit tongue training appliance that is designed to teach proper tongue resting posture and eliminate tongue thrusting or sucking habits. So in this image, you could see there that it has what's called a spot dot. It's a little hole right at the user's incisive papilla. So because this is custom fit, it is done with either an intraoral scan or a home impression kit. And with either of those, we're able to see the anatomy of the palate and see exactly where that user's incisive papilla is, and that their spot dot is placed exactly there. So it's not just generalized to be put in the same place for everybody. We're really able to look at that person's palate and see where theirs needs to be. And then on the backs of the teeth, we have little tongue pokes that act as a tactile cue for when and if that tongue does lose that spot dot and starts to push or thrust or rest too far forward on the teeth. The pokes are also custom to the user, so sometimes we could have a professional or provider tell us that they have a lateral thrust and they'd like the pokes to be more lateral. So those can be completely customized. We've had some users or some providers who have asked for no pokes because they want less tactile cue. They want their patient to be more independent. Sometimes people will transition from a S.P.O.T with pokes to a S.P.O.T without pokes to act as one less tactile cue as they start to gain the skills to be able to generalize tongue posture. But it is custom fit. They will be able to wear it comfortably. They will be able to speak with it in, drink with it in, which is something we use therapeutically also. And can help to support the elimination of sucking habits by discouraging the sucking, but replacing that with the tongue within the palate. So instead of just taking away a sucking habit, working to replace it with the tongue being in the palate so that the user is not looking for that sensation of that sucking. Most of them fit over the upper front 6 teeth. That's our standard type of S.P.O.T. I don't know if you have a good image of me, but this big guy here has the S.P.O.T on. And you can kind of see here that it is those front 6 teeth. However, they can be modified to include more teeth, especially if the user wants to sleep in their S.P.O.T, then we recommend a full arch. But our regular daytime training S.P.O.T appliance typically covers the front 6, which allows us to still work on the masseter engagement and those molars being able to contact one another on those types of masseter exercises. At S.P.O.T, I think mostly because of our background, Janine and I being speech therapists and myofunctional therapists, by no means did we want this product to just be a device you stick in your mouth, and then you kind of never hear from S.P.O.T again. That's not how we want this appliance or this tool to be. We really do want it to be inspirational. We know that sometimes these users have been dismissed by other providers or been told, not to worry, they'll outgrow it, or you don't, it's common, everybody does that. And they a lot of the times have this gut feeling that they shouldn't wait or they shouldn't ignore it. And we really want S.P.O.T to be something that allows the user to feel like they have been heard and that their concerns are justified. And this was important to us, especially like I mentioned, when we went public in 2023, we started very quickly to realize that although this appliance was designed to be in the hands of myofunctional therapists and other airway professionals, that people were also finding S.P.O.T on a more direct-to-consumer side because they don't have a myofunctional therapist in their state, or they don't have the resources to have a myofunctional therapist. Maybe they can't afford that, or they can't commit to something like that. And it was important to us to then be able to really be more of a platform for these users so that we could help guide them to the right professionals and to the right providers that can help them. So for those reasons, we made sure that we were active on social media, that we have a great customer service presence, that we're at events and trying to kind of spread awareness to other professionals and providers about this product. We have an 8-week exercise program that comes with every purchase so that the user can start some exercises to strengthen their tongue with their S.P.O.T in, but can also be used by the professionals. A lot of our S.P.O.T affiliates and therapists that are using it will use that 8-week exercise program for carryover at home as well. But it was just important to us that we really made them feel like we will be along with them during this airway health journey and this oral rest posture journey. We do believe that tongue health can change your life and that S.P.O.T can unlock the power of the tongue for individuals around the world. So what does S.P.O.T do? It is going to, like I've said, complement a myofunctional therapy program. It's going to act as a tactile cue that can help individuals with correcting their tongue posture, that you'll train them that little hole is their spot dot, and that's where that tongue tip is meant to contact. It can also help to improve intelligibility. A lot of the sounds in the English language are produced right at the spot dot. That's where your S, your Z, your T, D, N, L sound are all going to be produced. And there's also a variation that I'll show in a few slides that is our speech pal. And that has inside bumps on the inside of the upper molars that give a tactile cue for where that tongue should go for the R sound, all the way up and back in the palate. S.P.O.T is going to help promote nasal breathing. We know if we can get that tongue up, we can get the lips closed, and it's going to help us be better nasal breathers. It does promote proper dental occlusion and support the retention of the dentition from the perspective that we're getting the tongue off the teeth. If we know that we can get that tongue to fit within the confines of the palate, it's going to help to retain or stop the tongue from moving the teeth in ways that we don't want those teeth to be moved. And SPO.T can support the reduction in temporomandibular joint disorder symptoms, similar to how we would use myofunctional therapy for proper tongue posture so that the teeth can be slightly apart and everything can be aligned and we're not clenching and grinding those teeth. Just another close-up of those tongue pokes and that spot dot. Those two features being pretty consistent on any variation of our SPO.T. The benefits of SPO.T is that it is going to act as a reminder for where the tongue tip should rest and remind the tongue not to thrust on the teeth. Sometimes in the beginning of a treatment plan, especially, we need as much tactile support as possible. And as myofunctional therapists, we know that as important as what we do in our sessions is important, what they do outside of our session is really where all the magic happens for neuromuscular re-education. So being able to give our patients something that they can use at home when they're not within our treatment sessions. While we use SPO.T in session, we end up feeding it like we would a tactile cue. But when they're doing things at home, it's so important that we're able to give them something that makes them successful at training their tongue on where it should rest. It is going to help eliminate noxious oral habits, such as thumb finger sucking, tongue sucking, which is such a big one for us. Finger and thumb, we have other strategies, but the tongue can be the trickiest one because we can't remove the tongue from the mouth. So tongue sucking, this can greatly help with. It is proven to expedite and facilitate speech production, especially when obviously it's incorporated into speech or myofunctional therapy. It's helping to maximize the airway by facilitating proper tongue resting posture and getting that tongue to fit within the confines of the palate. And it is supporting and many times accelerating the habituation of proper tongue resting posture and that neuromuscular re-education, because we can target it even sooner, right from the start. A lot of the times within our treatment program, we're not ready to work on resting posture at home for the first few sessions because they have a hard time just maintaining the tongue to their incisive papilla within sessions. We work a lot with the pediatric population, so there's a lot less awareness and being able to kind of internalize what we're telling them to do. So this can act as such a great tactile cue that allows us to start working on proper oral rest posture right from the beginning of their treatment plan. How it works. So ultimately, the user can purchase their SPO.T at spotpal.com. And within the website, you're able to determine or select if you want it to be done with an impression kit that we mail to the user or to the professional. Or if they have access to an intraoral dental scan, then we can use that as well. The scan, or any of our affiliates that are dentists that have scanners, those are definitely the most accurate option. Or some of our myofunctional therapists or speech therapists, they work closely with dentists that have a scanner, and they'll do that. Although sometimes they will do the impression also. So the impression kit can go to the provider, to the therapist, and they can help their patient do the impression if they choose to do that. That's how most of our affiliates do it. They prefer to kind of have a few SPO.T impression kits in their office, and then they will do the impression with their patient and mail that to us. There are very specific instructions if it is a patient who you want to kind of not be so involved in the process and you just want to kind of say like, hey, check this out. I think it could be a great tool. And if it is going more to them, the family, the patient, there are really clear instructions on how to do the impression, because many times it's their first time doing that. And we do have a lot of checks and balances in place. They have 2 base and catalyst mixing options. So if they don't do great on the first one, they have a backup already there for them. And before they mail it to us, we have them scan that step 7 QR code and send us a picture of their impression so that we can look at it. That way we're not wasting any time. If they need to do another one, they can do it right then and there. And then it is created using the customization of that scan or impression, placing that spot dot where we need it. If there's any instructions specific from the provider, we'll see them and make them to their preference as well. And ultimately, we, like I mentioned, created different variations so that we can meet the needs of all different ages and all different types of dentition. So going through some of those, we have that basic that we spoke about. This tends to be the 6-year and older, although if they are losing some of those upper dentition, that's going to fall into our junior. The junior is just a mixed dentition customized spot pal. So ultimately, it could not enclose the front teeth. It could not enclose lateral teeth. Just depends on what their teeth look like in that moment. And we're able to see that and then create their spot pal so that it can still fit them and work around those teeth. We have our Spot Pal Mini, which is one of my personal favorites. I definitely also do specialize in that earlier age range, and that is for our 2, 3, and 4-year-olds. It is made of a slightly different material. It's more flexible, and it does have a caregiver handle, and that caregiver handle also acts as an additional tactile cue for lip closure, which we find to be so important for that age, because the more tactile cues, the better. And we're able to give them that prompt and cue to feel their lips on the handle so that they're keeping those lips closed, and to feel their tongue on that spot dot. Although the tongue's going to naturally gravitate to that once we start showing them to do that. You also have a full arch bite I spoke about. That's definitely recommended for individuals who do choose to want to sleep in their Spot Pal, or an individual who is working with an orthodontist and maybe they're coming right out of braces, or we have a few orthodontists that use this as a retention appliance following expansion. So if they need it for any retention purposes, then we could do the full bite as well. There is a lateral. That's just an example of somebody who may have a lateral thrust and they want those pokes more laterally. You can see the Speech Pal that has those little back upper molar bumps as tactile cues for where that tongue should feel for the R sound. Also helps the SH, CH, and J sound. And then we also have an athlete brand. We now call that our Sport Pal. And that's been really exciting. That's one of our newest variations that has come out. And that is for the athletes that either need dental protection, or maybe the sport doesn't require it, but they want to work on proper tongue posture and nasal breathing. And we know that there are so many studies and research that supports the fact that if, as an athlete, you can be breathing through your nose, you are going to be faster, your endurance is going to be better, your recovery is going to be better, all these things. So this promotes their ability to have a tactile cue to keep their tongue up and their lips closed. The Sport Pal variations do not have any of the tongue pokes. It's really just meant for giving that tongue a place for posture. And they can be worn to the level of protection. So our Sport Pal is of the same protection as a mouth guard. However, it's not going to be that boil and bite type. It's going to be custom to the point that they can also pick color. They could add their logo or their number to it. So it's been very desired and very exciting to kind of see and educate. We just went to a sport conference, and we go to so many dental conferences and airway conferences and myo conferences, and everybody knows this information. We're not kind of saying anything new, but hitting an actual sport market and being able to educate them. So many athletes, and they don't know that their tongue should be up. They don't know that they should be breathing through their nose. So as lip taping and those things get more popular, there's definitely better awareness of it. But this has been great for the athlete as well. And there is a variation if they don't want protection of the dentition and they want it to be more discreet. You could see the Sport Pal fit where it doesn't cover the front teeth. So no one could really tell that it's in the mouth, but it's still supporting them with their tongue posture and nasal breathing. We are the official mouth guard for Brown University's lacrosse program. So that just is image there that you could see their sport pals in. What's great about this too, for anyone who works with athletes or is an athlete, you can talk with it in, you can drink with it in. So many times they're kind of grabbing their mouth guard, taking it out, shoving it somewhere it should never go, and to take a drink, or, you know, to yell a play or whatever it is. But in this situation, you wouldn't have to do that. This slide talks about our S.P.O.T program that I mentioned, an 8-week exercise program. It is not myofunctional therapy. It's not called myofunctional therapy. It's really just called a tongue strengthening program. And it takes the user through video modules of different tongue exercises that they could do with their S.P.O.T in. And as I mentioned, a lot of our myofunctional therapists or our dental providers that are using S.P.O.T do use this for their patients to do at home. And within this exercise program, it does gradually get harder in exercises as they're going, because we anticipate that their skills are getting better. And it also talks about their S.P.O.T wear time. S.P.O.T at a maximum, it will be in a slide or two. We try to get our users in it up to 2 hours a day, spread out across the day. So this is not something that they need to be in all day. And when you're doing this exercise program, it gives you recommended wear time. So a lot of the times, especially, you know, when they first put their S.P.O.T in, they could feel like there's no way my tongue should be resting in this position, because their tongue has not rested in that position for so long. So sometimes even adults need to increase their wear time more gradually. So week 1, it might just say to wear it 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes before bed. And then week 2, we're saying to wear it 15 minutes 3 times a day. So it kind of just increases from week to week, getting them to that 2-hour time frame each day. And then some users can just pop it in for 2 hours, spread out across the day right from the beginning. It's just individualized and depends on the user. When we work S.P.O.T into a myofunctional or speech therapy program, there's no right or wrong time to work S.P.O.T into such program. Some of our patients use it right from the beginning. Some, you know, start a program and then midway they start to realize things are moving slower than we would want. Maybe we need a little extra tactile support to kind of help this patient get over this hump. Or maybe at the end of the program and we realize, you know, when they're thinking about it, they can have that tongue where it needs to be, but subconsciously it hasn't carried over. And this could be that extra little boost then. So depending on the patient, depending on the professional that is guiding the patient, S.P.O.T can be worked into the beginning, the middle, or the end of a program. But regardless, it is going to help them very quickly and easily find their spot. Definitely with the pediatric population, we could spend sessions just trying to get that tongue tip to go to their spot. So this is going to cut out a lot of that time. It's going to allow us to begin targeting proper tongue resting posture from the start, especially when we're not there to guide and support them and we're having them practice at home. It's going to accelerate the habituation of proper tongue resting posture, act as a continual cue for tongue tip at the spot, and that's going to help guide the rest of the tongue body to the rest of the palate. Keep the lips closed and breathe through the nose. And it will also give those tactile cues for proper speech production. There is a lot of positive feedback that we love to hear and be shared with us on how therapists are feeling about S.P.O.T worked into their treatment plans. They, you know, feel that it is definitely helping to improve the lingual suction or pull or cave that the patients are working on and engaging in, that it is helping support the articulation of the S's and Z's and those different sounds we talked about. Definitely very consistently hear about how S.P.O.T is such a great tool combined with a tongue tie release, and using S.P.O.T before and after the tongue tie release. Our dental providers also share some wonderful feedback. Hearing that it's the missing link in dentistry was definitely an exciting comment to hear, that it is changing function to support the long-term success of orthodontics, that it is great for patients between phase 1 and phase 2 orthodontics, supporting patients with sleep disordered breathing related to improper tongue resting posture, and again, great training pre and post lingual frenectomy. And the patients are really happy with it as well. Again, that custom fit is going to make it very comfortable for the user. The Spot Pal is actually made of a material, when it is 3D printed, that softens with heat. So when it does go in the mouth, because of the temperature of the mouth, it gets even softer. And that allows for that comfort level to be at its highest. That also helps when someone's dentition changes a little bit. If we put it in hot water, cool it for a second, put it back in the mouth and kind of push on those teeth, it will remold to slight movement and changes of the dentition. But if there's a lot of change and they need a new one, we also do have a pediatric reorder program where they can get a new impression or a new scan and a new appliance at a 50% off price range because they're already a Spot Pal user. And in conjunction with myofunctional therapy, we're going to complement the exercises that they're working on and work alongside and in conjunction with other myofunctional tools. So that's something that we get asked a lot, like, well, would this replace this, or would I do this instead of that? And most of the tools that are in our Myo toolbox, they complement each other. And some are great for all patients. Some patients respond better to one than the other. But ultimately, you know, if you think about Spot Pal and a Myo Munchie or a Myo Brace or any of those other types of tools, they can work alongside. They all have different goals that complement each other. As I mentioned, that it's used up to 2 hours a day. That spreading out across the day is really important because that's going to help us get that neuromuscular re-education going within their mouth, and they're feeling all those tactile cues. Then it comes out and they still have the sensation of where those tactile cues were and where that tongue tip was supposed to be and how the rest of the tongue followed up in the palate. And even though it's out of the mouth, it's still working. And then it goes back in the mouth and out and back in and then out. That's going to really help from that passive perspective of just pop it in and go about your day and let the tactile cues do their magic. That is those 2 hours that we want, compared to being able to use it on a more active perspective of when they're doing actual exercises and using it as a tactile cue and being able to fade it when they don't need that tactile cue anymore. This is just a video, and I'm gonna play it a few times, but this patient had, it was the same session, and we were working on getting that suction and being able to swallow. So you can see, and I have still images, screenshots after this, but this was all in the same session. And you could see how much more symmetrical and stronger her suction was when her Spot Pal was in compared to out. And then you can also see how much less that tongue thrusted on the teeth when the Spot Pal was in compared to out. And this would kind of tell us as the clinician that this user is not ready to fade their Spot Pal yet from that active perspective, because there's still a lot of deficits happening when we took it out. So this is some of those still images, and you can see with her Spot Pal in how much more symmetrical her pull is, how much stronger it is. It's fitting better within the confines of her palate compared to when she was trying to do that same suction without her Spot Pal in. And then same thing here, she's swallowing and that tongue is pushing through all those spaces in her dentition compared to here on the swallow where you don't see that tongue pushing at all. So this is just an example of how we're using it within a therapy session. And then I will go into, just want to check the time, Grace. So Grace was one of our adult patients and users. She was 23. She had a significant tongue tie, which we can all see in that lower picture. But she was always told, you know, as a child, they knew she had a tongue tie, but she speaks and eats fine, so don't worry about it. Grace came to us and she was complaining of temporomandibular joint pain, back pain, upper neck and back pain, which everyone had kind of attributed to her cheerleading career that she did all through high school. Grace also told us that she grinds her teeth, which her dentist told her was from stress and gave her a mouth guard. So other things we know is that she used a pacifier until she was 3. She was bottle fed due to low maternal milk supply, which can mean that she just couldn't latch to actually withdraw any milk. So her mother's body wasn't told to produce more milk. And this video here is just some assessment. We can see the shaking and fasciculations of her tongue. A heart-shaped tip. She has a really hard time doing anything with that tongue.
And then I want you to bring your tongue in and out and in.
Trying to move it out and in. You can see the jaw involvement. You can see the tongue resting on the lower lip. Side to side. She can't lateralize that tongue tip at all.
Bottom lip.
Obviously very limited in the elevation, and she was also complaining of daily jaw pain, migraines. We talked about the back and neck pain. She felt she prefers mouth breathing compared to nasal breathing. She wakes up feeling tired and unrested. So we did her evaluation. We recommended 3 to 4 weeks of myofunctional therapy before referral for a frenectomy consultation, with myofunctional therapy continuing following the release, and S.P.O.T complementing her myo program pre and post tongue tie release. So in this video, it's before her release, but she is getting awareness of where her spot is. She is establishing awareness of dissociation. She really functionally couldn't do any of this because of how tied her tongue was, but that awareness was really important for her. We improved some tongue tone and tensing the best we could pre-release. We worked a lot on nasal breathing beforehand because she was clear nasally. It just wasn't her preferred breathing pattern. Awareness of proper oral rest posture, improvement in tongue strength, and establishing some lingual suction, the best we possibly could for her. So this was after a few therapy sessions, when she was ready for her referral. She can get some clicks, weak, but and a lot of jaw involvement and a lot of jaw support, but getting it.
Okay.
Then she knew to kind of watch her jaw and, you know, be aware that her jaw was shifting, and we were going to work on it not shifting after the release.
Good.
And then you'll see a little bit of a suction.
Wait, start at this spot.
And she, you know, she's so
I've been
aware
doing
that she knows
right behind my teeth.
that it's her, like that she can't do it. She's trying, but she just can't do it.
Yeah.
And then she was underwent a lingual frenectomy with Dr. Scott Siegel. He is local to us, so we're very lucky to have him as one of our release providers. And you can see here the huge changes that she had. And she had drastic improvement in her sleep, her jaw pain, her neck and back tension.
And I want you to open as big as you can.
How much more
and I want
she
you to bring
could
your
do
in
with the tongue after the release. And that, you know, S.P.O.T was something
And
that we
then out.
wanted her treatment plan
In.
to really help with
Out.
the
in.
the and getting the awareness
I
and
want you
teaching
to
that tongue
go
to be
to a
off
shot.
the floor of the mouth.
Perfect, and open as wide as you
And I think, let's see,
can. Okay.
I don't want us to run out of time, but this is her utilizing her S.P.O.T in some of her treatment or some of her practicing.
And then do like out and up.
This was pre-release, obviously.
Open as big as you can. And bring your tongue up as far as you can. Open as big as you can. And click. And hold your book.
You can see she's actually able to hold that suction somewhat, which is impressive with the severity of her restriction. And then this is her doing her own practicing without a therapist there and being able to get that suction. Her tongue tip is staying stable on her spot dot, which is going to allow the rest of that tongue to get better up in that palate and fit within the confines of the palate and not let the tip slide backwards or slide forward, compromising the suction.
Okay, I'm done.
Perfect. Okay. And then just go into somebody who's younger, and this being a patient who was 5, he came to us for speech issues, but he was in our Myo program and being treated for oral motor, expressive speech, oral stage swallowing, and chewing and swallowing therapy. I won't go too much into him because I know we're getting close on time, but just to kind of show you in this video, he's doing some exercises with his therapist and using his S.P.O.T. You will see it here. He's missing some of his dentition. So this is a good example of our S.P.O.T. Junior, where we're able to kind of modify the appliance to still match the dentition that the patient presents with.
Okay. And right there. Good, and open. Somebody stop. Good, look up a little bit. Good. Awesome. And bite down and smile.
Okay. And then you can see in this next video of him, this is just a little activity in session where we're working on resting posture at rest, where he is kind of playing with something, playing with a toy, letting the tactile cues work, and then the therapist asking him every few seconds, show me that tongue, is your tongue on your spot dot, and trying to work on that resting posture.
Show me your tongue on your spot dot. Close. Open. Let me see. And close. Show me that pull, right, when you open? Show me your tongue on your.
Perfect. And then again, I know I've already said it, but we are a tool that can complement myofunctional therapy and can work really nicely with all the other tools that some of us love to incorporate into our treatment plans. This was a fun conference we were at, and a lot of these people in this picture are part of these appliances, and we are all working together, which is exciting because that collaboration is so important for our patients. If you are interested in at all being a S.P.O.T affiliate, there is an affiliate program that is available. This QR code can bring you to that sign up. You can also go to spotpal.com, but ultimately as a S.P.O.T affiliate, you do have access to some trainings, to consultations with me, as well as getting a 10% commission on any S.P.O.T that is sold through your affiliate link. And that's just some of our contact information. We are, as I mentioned already, really feel very strongly about customer service, and whether that be to the patient or to the professional, we always want to be able to communicate and do what's best for the patient. So we're always available through email or website chat or phone, social media, however you want to contact us. And that's just Janine and I's contact information. I provide, and so does she, our LA Speech email, just because we're in that nonstop. I do have a S.P.O.T email as well, but that's the best place to catch me right away. And then we also co-host a series called Talk the Talk. Renata was on that with us. And we interview a lot of different experts and professionals on topics related to myofunctional therapy, if you're interested in viewing that at all. And that is everything.
Yay! That was wonderful. Thank you, thank you, thank you. I did not know as much about it as, I mean, the amount of research, the seeing it in action makes a huge difference, worlds of a difference. Oh my goodness.
Yeah.
Thank you so much for sharing that with us. What a win for our field for myofunctional therapy that you guys were able to create this, and look how much it's helping our patients. This is wonderful. We have some questions over here from Anne. What happens?
Okay.
Oh, you mentioned this already, remember. What happens from palatal growth if anatomical structures shift? How often does a new spot scan needs to be taken?
Definitely very individualized. We can have somebody, even pediatric, in the same SPA-PAL for 6 months and no issues, a year, no issues. Obviously, with the adult population, they usually just need one and it's going to fit forever unless they do something to it or lose it. Pediatric, if they are going through early development, especially like for our mini, right? We could be in a 2-year-old's mouth and we want to get that tongue up there. So we hope their SPA-PAL doesn't fit after a few months, because that means we're doing the right thing. We're getting some natural growth by the tongue being in the palate. And that's why it was important to us to make sure we had that pediatric reorder so that they were not paying the same full price. They get 50% off. And if, again, those little changes, especially if they're maybe 5 or 6 and there's like very mild changes from the tongue being up there, if we just put it in some hot water and re-put it in, it's going to fit still.
Oh, that's amazing. Is there any reason you would only focus on anterior tongue anchorage instead of the mid-tongue to palate contact?
So it's working on the whole tongue being up there. Just the tactile cue is for the tip of the tongue. But if we can give a tactile cue for the tip of the tongue for where it should be, the rest of the tongue is going to follow. That's going to happen therapeutically. We could help get that suction be better because the tip is staying maintained and stabilized to the spot. But it can also happen very subconsciously, that they're feeling that tactile cue, their tongue tips up there, and the rest of the tongue just follows.
Amazing.
But yes, definitely want the whole tongue up there.
Are the tongue pokes more punitive like habit correctors?
Not at all. They do not hurt. They are not spiky. They, Autumn Henning actually used the term speed bumps to describe them. And I loved that terminology for them. They really just do act as like a border that just reminds the tongue if it's gone too far forward and on those teeth. But no, not going to hurt the user at all.
I love it. And you have some good questions. I don't even know what this one means. How do we encourage generalization and extinction of the tool for habituation? Okay, I get it.
Yeah. So similar to a tactile cue that we would want to fade, we will fade this too. So I showed the images of that one girl. She wasn't ready to fade her SPA-PAL from that more active perspective because the skills weren't they were still needing that maximum support. But once from an active perspective, they start to show that they can do it, we want to fade it and then get them to be able to do those exercises and movements without their SPA-PAL. From a passive perspective, that's where we can sometimes increase their wear time to those 2 hours a day. And then when you therapeutically as the therapist or as the provider start to feel like, okay, I want them to maybe wear it less time because I want to make sure their tongue's in the right place without the support of their SPA-PAL, then you can start to decrease their wear time during the day also. Just depends, again, so much on the individual, their treatment plan, and what you feel like is going to be best for them.
Perfect. How have you seen it help minimize or eliminate a tongue sucking habit? Are there any cases that come to mind?
Yeah, so there was actually, which, sometimes we hear things and we're like, is this real? Did that really happen? Like, are they just saying that to make us happy? But it was I think he was maybe 7 years old, this little boy, and he came into his session, literally, I think it was maybe a week later after he started using his SPA-PAL, and he was like, I think I'm not sucking my tongue anymore. Could that be possible? And I'm like, wait, could you say that again? Let me record this. But no, they, again, so much of that sucking is because the tongue's not up there. They're looking for sensory stimulation in that mouth. They're looking for something to activate their parasympathetic system so that they can relax and just calm and soothe. And if we can start getting that tongue up there, it will allow them to not rely on that sucking habit, like tongue sucking. We're giving them something else to put where to put that tongue so that their tongue's less likely to go forward and start sucking on that tongue.
Amazing. How or can you eat with any of them in place?
We don't recommend it just because it can kind of compromise the appliance, get it a little yucky. But if you do it properly, and I've had a few patients where I kind of wanted to just give them that tactile cue on a bolus swallow because I felt like it was going to really help them. So they can safely swallow with it in. It's not going to put them at any risk, but I take it out immediately, get it run under water right away so nothing kind of hardens up on it.
Yeah.
But
I like the
technically,
tactile for bolus formation and swallowing in the right place. I like that.
Yeah. You just want to take care of it, then give it a little brush.
What material is Pawpaw made of?
It is made out of a 3D resin material, similar to any type of 3D printed kind of clear liner. It's that same material. I don't know the exact resin name, but again, it is the one that also softens with the heat because that was really important to us for the refitting purposes, but also just for the comfort purposes.
How many times can you use the same one?
As long as it's fitting, you're going to keep using that same one. So yeah, indefinitely.
Like if I grow and I have
based
to
on-
reboil it, if I have these anatomical changes and I have to reboil it, then how many times can I reboil it?
Yeah. Well, one, you don't have to technically boil it. It's just got to be hot water. So it doesn't have to be boiling water. It could be just hot water. And then you could do it. Yeah. You could do it as many times as you want to, as long as it's still fitting. So we've had people who where, it's fitting and then it starts to get a little tight. Maybe things are changing. They put it in the hot water, reshape it. It's good for a few weeks or months. And then they do it again and they could just keep doing that. And then sometimes the change is just at a point where we're like, okay, let's consider, an updated scan and an updated appliance.
That's genius. I love it.
Yeah.
I think these are all the questions from our audience right now. Thank you, Anne, for all the incredible questions. Thank you, Toni-Ann, for hanging out with us today and sharing this incredible device that you guys have come up with to support everything that we're doing with myofunctional therapy. Any last words, or do you want to share with anybody? You have a conference coming up.
Oh, we do have a conference coming up. Well, first, thank you so much. And truly don't hesitate to reach out to me. I left my email. I'm so happy to answer questions and help in any way that I can. And it is always such an honor when you ask us to do anything with Airway Circle. We love you. We love Airway Circle and everything that you guys are doing. And yes, we have a virtual myofunctional collaborative conference coming up in October, and Renata is one of our wonderful speakers. So if you head to myomanagementgroup.com, you can see the registration link, or just find us on social media because we keep posting about it there too. But it is definitely going to be a great one. It's a 2-day, a Friday and a Saturday, this October 17th and 18th. Fully virtual, and if you can't make the dates, you also get 3 months of recorded access for it too.
Incredible. It's going to be so good. I saw the lineup and it's like, oh, how am I in the middle of all these people? It's incredible. Thank you for the invitation too. And we will see you guys next Thursday. Just as a reminder, I'm not really sure when this is going to play, but every August, we're changing things up. So August 2025, we are starting Foundations of Orofacial Myofunctional Therapy. It is our intro course. We changed it up a bit. So now it's 12 weeks, 12 sessions that we meet, live sessions that we meet, plus the recorded content. But we have added, so we reduced the weeks, but we have added 4 months of support afterwards. So you guys take the course and we keep meeting for 4 months to help those people that are just starting and that need that extra community and support. And now, if you're ever interested in taking MyoCircle, which is our advanced myofunctional therapy course, that's usually in January, we have also switched that. So now foundation's a prerequisite. You have to take foundations of orofacial myofunctional therapy to be able to take MyoCircle. So August 2025, we're going to do foundations. January of 2026, we're going to do foundations again to allow enough people to come in so they can take MyoCircle in the fall. So starting next year, January is going to be foundations, 12 weeks plus 4 months of support. And then MyoCircle is going to be every August now, and it's going to be 16 weeks. So we have increased the amount of time for MyoCircle, the advanced course. And we're super excited for everybody that's coming in, for all of our students and everything that they're saying about our courses. I mean, your mind is blown. If you've been practicing myofunctional therapy and you have not taken one of our courses, you have to listen from our students, because everybody that takes it, they say, you know, we've taken courses everywhere and we've never learned it this way. We are not doing it this way. And everybody starts changing because we teach how to look at the patient from generalize, look at the whole patient, and the way that we prescribe exercises is 100% different. The way that we teach people how to do the phases treatment, it's 100% different. So it's what you're doing in Brazil right now. It's the latest research, and MyoCircle really teaches you the why behind the exercises. Why are you doing what you're doing? Why are you prescribing this exercise? And why are you prescribing it a minute or two? Who taught that? Who came up with 2 minutes of exercise nonstop for the orofacial muscles? It makes zero sense. So come join us August 2025. The registrations are open for foundations. If you missed that, January 2026 for the next foundations class. And thank you so much for being here. Those are all the announcements I had. We love you guys. Have a wonderful day. Mwah. Bye, girl. Bye.